Hello, welcome to our first board video podcast. I'm speaking from Wincanton Community Hospital, where we've just finished the board meeting for January. Now firstly, I'd like to reassure you that we haven't filmed this using expensive cameras and other technology. It's been filmed using the iPhone, other smartphones are available, of Victoria Eld, who's our Director of Communications. And I'd be really grateful for your feedback regarding whether you think this is a good way of us communicating with you regarding the board and its work. This is the first time the board meeting has been at Wincanton Hospital, and it's great to be here and to see colleagues who perhaps don't normally have an opportunity to meet board members. Today's board meeting was also the first time that we had a patient story. I'm really pleased that we were joined by a service user from CAMS, who spoke very powerfully regarding his experiences over the last 18 months and some of the challenges he's faced and the support he's received from colleagues working in Frome. It was really helpful, I think, for board members to hear firsthand from one of our patients regarding the services we provide as an organisation. One of the concerns was the time he had to wait to be seen and also the gaps between appointments, but the quality of care he received was undoubtedly fantastic. The board today endorsed our new trust values. You'll be aware that over the last 12 months or so, a lot of work has been ongoing to engage with colleagues across the organisation to seek their views regarding what our values should be. And the values that we have adopted now are that everyone counts, we make a difference, and that we work together. And what the board also endorsed was a set of behaviours to ensure these values are embedded across the organisation and really become central to how we do things. The board also received a very detailed report from Sue Balcom, our Director of Nursing, regarding how we investigate serious incidents. And this report looked at the report by the CQC, which was published in December last year, regarding how organisations across the country investigate unexpected deaths. You'll be aware that that report was very critical of the NHS in general and highlighted that all trusts could improve and indeed should improve how they investigate unexpected deaths. So with that in mind, I'm really pleased that Sue will now be the Executive Director for taking this important work forward, and that also one of our non-executive directors, David Allen, will be responsible for patient safety at a board level, and that's a really positive development. We heard today also regarding flu immunisation. I've spoken and written previously regarding the importance of flu immunisation, both in terms of ensuring the health of staff but also health of our patients. And with that in mind, it was disappointing that this year only 44% of clinically facing staff were immunised, and that's a good deal below the 75% target for us. And clearly going forward, we really do need to improve on this and ensure that colleagues across the organisation have the flu vaccine next year. Staffing obviously remains a real challenge for us. I was pleased to hear that the situation in West Somerset, where we've had to temporarily close beds in Minehead Hospital, has improved somewhat. And I was also pleased to hear that the recruitment day that took place last Saturday in the west of the county was successful, and we've got 7 staff who hopefully will be joining us in the not too distant future on the back of that recruitment day, some of whom live in Willerton, which should help in relation to the problems we're encountering in both Willerton and Minehead. So with that in mind, it was pleasing that our agency use over the Christmas period was a lot lower than we had forecast, and that's a great tribute to all who manage budgets across the organisation, particularly our sisters, our matrons and our heads of division. And a big thank you to all of you for your hard work over the festive period in relation to managing the staff resource so effectively. And finally, I'm very pleased to report that Sue Malcolm also informed us today that the Trust will be a pilot site for the new nurse apprentice role. This is a 2-year pilot that's been rolled out nationally, and the idea being that nurse apprentices will train during that period and work alongside trained nurses, and going forward they will be able to free up the time of our trained nurses and ensure that nurses only do the stuff that they are trained to do and therefore can work at the top of their licence. Various other things were discussed today. It was a busy agenda, but I'm conscious of your time, so if you want to find out more regarding today's meeting, the board papers are available on the Trust website and via the intranet. Thank you very much.